Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering delegating authority. So as a registered nurse, what type of patients and what type of situations would you delegate to an LPN versus an unlicensed assistive personnel? If you have a list of different diagnoses and there's these things going on with the patient, how do you differentiate what you would allow the LPN to do versus the UAP? What is your responsibility as a registered nurse when you delegate a task? Okay, I'm going to cover all of this in my video. If you haven't done so already, guys, please don't forget to like and subscribe below. If you haven't done so already, make sure that you guys check me out across all the other social media platforms. My handle's still the same, Nexus Nursing. I'm on TikTok, I'm on Instagram, and of course, you guys know I'm on here on YouTube. I'm also on Facebook, okay? My handle's the same, Nexus Nursing. Also, something else I want to talk to you guys about, do not forget my audio lessons are available on my website, www.nexusnursinginstitute.com. And I cover an array of topics. So if you're in the nursing program right now and you're struggling and you just really need to hear my voice, pointing things out, telling you this is most likely going to be on your exam, you need to know this, head over to my website, Nexus Nursing Institute. Last thing I'm going to talk to you guys about before we get started, my tumblers. Okay, guys, so I have tumblers available. This is my merch on my website, nexusnursinginstitute.com. And guys, I go over, well, on my Tumblr, it covers blood compatibility. It covers priority patients. It covers important words. When you're reading your textbook and you see those words, it's most likely going to be on your test, to make sure you pay attention to it. Okay, so make sure you guys go on my website and check out my merchandise if you'd like to support Nexus Nursing. Okay, guys, without any further ado, let's get started. First question. The new graduate working on a medical unit night shift is concerned that the charge nurse is drinking alcohol on duty. On more than one occasion, the new graduate has smelled alcohol when the charge nurse returns from a break. Which action should the new graduate nurse implement? 1. Confront the charge nurse with the suspicions. 2. Talk to the night supervisor about the concerns. 3. Ignore the situation unless a nurse cannot do her job. Or 4. Ask to speak to the nurse educator about the problem. And guys, the correct answer is 2. Talk to the night supervisor about the concerns. So guys, if you've been following me for any amount of time, you know I've preached this to you many times before. So if you have an issue with another nurse that involves patient safety, you do not confront that nurse. You go to your supervisor or that nurse's supervisor, but you have to take it a step above. If you have a personal problem with a nurse, you think they don't like you, blah, 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 then you go to that nurse directly. But if patient safety is involved, you move up the ladder of command and you go directly to the supervisor. So that's why number 2 is the correct answer. Now let's look at our answer choices. 1, confront the charge nurse with suspicions. Didn't I just tell you if patient safety was involved, you don't go directly to the person? That's number 1. And number 2, if you see an answer choice that says confront, that's not going to be your answer, okay? Because we don't want to confront anyone. We want a solution to the problem, so that's not going to be it. 3, ignore the situation. Oh, so patient safety is involved and you're just going to ignore it? No, you're not. Absolutely not. So that's wrong. And then choice 4, ask to speak to the nurse educator about the problem. The nurse educator is responsible for educating the staff about new technology or new machines that have been ordered to teach them how to use it. The nurse educator doesn't have anything to do with that. You're going to go up the chain of command to the supervisor. So the correct answer is number 2. The charge nurse observes 2 unlicensed assistive personnel arguing in the hallway. Which action should the nurse implement first in the situation? 1, tell the manager to check the UAPs. 2, instruct the UAPs to stop arguing in the hallway. 3, have the UAPs go to a private room to talk. Or 4, mediate the dispute between the UAPs. And guys, the very first thing that you're going to do is number 2, instruct them to stop arguing in the hallway. That's the very first thing. Whatever it is that they're arguing about, you see all these other choices, we can do it later in the private, quiet setting. Let's go through the wrong answer choices. 1, tell the manager. Let me tell you something. When you're testing, don't ever pass the buck. Don't pass the buck on something you, the nurse, can do. Those are 2 UAPs. You, the nurse, can instruct them to stop arguing in the hallway, and they need to stop arguing in the hallway. Don't pass the buck. So that's wrong. Choice 3, have them go in a private room. Yes, but you're going to have them go in a private room after they stop arguing. What, you going to have them argue all the way till they get to a private room? No. And then choice 4, mediate the dispute between the UAPs. That's fine, but you're going to do that after they stop arguing in the hallway. So the first priority is the problem, which is them arguing in the hallway. So you're going to get them to stop first. The graduate nurse is working with an unlicensed assistive personnel who has been an employee for the hospital for 12 years. However, tasks delegated to the UAP by the graduate nurse are frequently not completed. Which action should the graduate nurse take first? 1, tell the charge nurse the UAP will not do the task delegated by the nurse. 2, write up a counseling record with objective data and give it to the manager. 3, complete the delegated task and do nothing about the insubordination. Or 4, address the UAP to discuss why the tasks are not being done as requested. And guys, the correct answer is number 4. The first thing you're going to do is assess. Remember, guys, assessment is anything that garners information. So asking questions is a form of assessment. Remember ATI? A is for assessment. The first thing you're going to do is get information. Find out why she's not completing or he's not completing those tasks. What if it was a language barrier? What if it's that the graduate nurse who's, new to the facility is using wording or lingo that the UAP doesn't understand? So the first thing the nurse is going to do is to assess the situation, have a talk with the UAP and find out what the problem is, then move on from there. The primary nurse informs the shift manager of one of the unlicensed assistive personnel's falsifying vital signs. Which action should the shift manager implement first? 1, notify the unit manager of the potential situation of falsifying vital signs. 2, take the signed client's vital signs and compare with UAP's results. 3, talk to UAP about the primary nurse's allegation. Or 4, complete a counseling record and place in the UAP's file. Okay, guys, and the correct answer is 2. Go take those vitals yourself. At the end of the day, patient safety is priority. So if someone comes to you and tells you that the person who just took the vital signs faked it, they weren't real vital signs, our concern is that patient. We need to make sure that patient's okay. So we're going to go take those vital signs ourselves, and we're killing 2 birds with 1 stone here. Number 1, we're making sure our patient's okay by checking the vitals ourselves. And number 2, we have a set of vitals to compare with what the UAP just took. You just can't take somebody's word for it without assessing the situation at all. You can't just go accusing anybody. So that's what you're going to do. Go to the patient, go take those vital signs yourself, and then compare with the vital signs that were taken previously. The nurse hung the wrong IV antibiotics for the post-op client. Which intervention should the nurse implement first? 1, assess the client for any adverse reactions. 2, complete the incident or adverse occurrence report. 3, administer the correct IV antibiotic medication. Or 4, notify the client's healthcare provider. And guys, I think by now you're starting to see a theme. The correct answer is 1. You're going to assess the client for any adverse reaction. So you accidentally gave the wrong medication. Before you call the doctor, before you do anything else, assess your patient. Make sure there aren't any adverse reactions for the medication you accidentally gave. Make sure you didn't cause the patient to go into a hyper or hypotensive crisis, right? So you're going to check that patient's vital signs. ATI, assessment, diagnosis, planning, intervention, evaluation. The A is always first. So guys, whenever you're given a set of questions, always say to yourself, where am I in this question? If in the question they already showed you that you assessed the patient, they gave you vitals, or they gave you information that you already assessed the patient, then by all means you can intervene, right? But you cannot intervene for a patient until you have assessed that patient, okay? So that's why number 1 is the correct answer. Number 2, complete incident or adverse report. That you can do after everything else is done. After you've assessed your patient, after you called your doctor, let the doctor know you gave the medication, after you've gotten new orders from the doctor, because maybe the doctor wants the same med he originally ordered, or maybe that doctor was like, whoa, well now because you administered this wrong medication, I can't give this, I want you to give that instead. right? After you get the new orders from the doctor, after you implement those new orders from the doctor, after you assess your patient, after you implemented those new orders and your patient's stable, then you can go and document. It's always patient before paperwork. That paperwork is last. Okay. By the way, guys, you're going to document occurrence report. The occurrence report goes in a separate file for the facility. It does not go into the patient's medical chart ever. Matter of fact, you cannot even mention an occurrence report in the patient's medical chart. Okay, the occurrence report is something completely different than the medical chart. You cannot even mention it. You can't put it in there. Got it? Good. Okay. Choice 3, administer the correct IV antibiotic medication. What if the doctor doesn't want that med after you accidentally gave a different med? So you can't do that. You gave that wrong med after you assessed your patient. You have to call the doctor and let them know. And the doctor will tell you either to give the correct med or to give something else. And choice 4, notify the doctor. Absolutely. You're going to notify the doctor after you've assessed your patient. Because I want you to think about this, guys. You realize you gave the wrong medication and you immediately call the doctor. The first thing your doctor is going to say, okay, well, how's the patient doing? You didn't even take a set of vitals. You didn't check anything. You're not going to have anything to say to the doctor. So you have to assess your patient so you can have something to say to the doctor when you call them. The nurse, a licensed practical nurse, and an unlicensed assistive personnel are caring for patients in a critical care unit. Which task would be most appropriate for the nurse to assign or delegate? 1, instruct the UAP to obtain the client's serum glucose level. 2, request the LPN to change the central line dressing. 3, ask the LPN to bathe the client and change the bed linens. Or 4, tell the UAP to obtain urine output for the 12-hour shift. And guys, the correct answer is 4. Tell the UAP to obtain urine output for the 12-hour shift. Remember, guys, UAPs can record and report. And here's how they try to trip you up, because if you look, the patient can do number 1, they can do a glucose check. They absolutely can do a glucose check. But if you have to choose between doing a glucose check and collecting data on an INO for a UAP, you're going to give the least invasive one, which is going to be just getting the urine output. So that's why number 4 is the correct answer. Number 1, getting the serum glucose. Absolutely. The UAP can do that. Guys, I'm from the state of Florida, so I'm only talking about the state of Florida. If you live in another state, you have to look to see if the UAPs can do. But in Florida, they absolutely can do it. But if you're choosing between something invasive, a venipuncture, or just recording for a UAP, obviously you're going to choose a recording for the UAP because you have an LPN, and that LPN can take the glucose, and while they're there, the LPN can do an assessment on the patient. Now, speaking of assessment, you guys seem to get this confused, thinking LPNs can't do assessments. They absolutely can do assessments. So before an LPN gives a blood pressure medication, you don't think they're going to take that blood pressure to make sure the blood pressure is not too low? That's an assessment. LPNs can do assessments. They just can't do in-depth assessments such as admissions, such as discharges. Okay? So that's why number 1's wrong. Number 2, request the LPN to change central line dressing. LPNs can do many things, but they cannot do central lines. They cannot do central lines. They can't do blood transfusions. They can't do piggybacks. They can't do pushes. Okay? So that's why number 2 is incorrect. And number 3, ask the LPN to bathe the client and change the bed linens. Well, you have a UAP, so why would you have an LPN do that? The LPN is going to do nursing care. So the correct answer is number 4. Which task should the critical care nurse delegate to the unlicensed assistive personnel? 1, check the pulse ox reading for the client on a ventilator. 2, take the client's sterile urine specimen to the laboratory. 3, obtain vital signs for the client in Addisonian crisis. Or 4, assist the healthcare provider with performing a paracentesis at the bedside. And guys, the correct answer is number 2, take the client's sterile urine specimen to the laboratory. That's all they're doing. They're transferring that urine to the laboratory. UAPs can do that. They can transfer what's the word I'm looking for? They can transfer body fluids or secretions like a sputum culture. They can bring that up to the lab, or urine. They can bring that up to the lab. They can go to the blood bank and bring down blood to give to the nurse, because they're not doing anything with it. All they're doing is transferring. Just like they can transport equipment. They can go get a wheelchair. They can go get a walker. Right? LPNs, UAPs can also do what? ADLs with the patient. They can record and report. So absolutely, all they're doing is bringing that urine to another location. They can do that. That does not require critical thinking. And guys, I'm not saying this is any way to bring down UAPs at all. I'm just trying to help you kind of remember and be able to differentiate in different situations what you can allow the UAP to do versus someone who is licensed. So I want you to think of it in that terms. If they're not licensed, they really can't do anything that requires critical thinking, some type of assessment, some type of evaluation, some type of monitoring. They can't do it. So let's look at our other answer choices, guys. 1, check the pulse ox reading. Just checking pulse ox reading, but the client's on a vent. That client's not stable. That client's not stable. They're on a vent. The other one, choice number 3, obtain vital signs. They can get vital signs. For a client in Addisonian crisis, that client is not stable. Number 4, assist the healthcare provider with performing paracentesis at the bedside. Only the LPN and the RN can help assist the doctor. The unlicensed assistive personnel should not be assisting the physician with procedures. So guys, number 1 and number 3, the reason those are wrong is because the patient is not stable at all. So if you want to get the pulse ox, or you want to get the vital signs, at least send that LPN in there to get it, because that patient is not stable. If you don't have a choice and you're looking at the list, guys, you have to look at the most stable patient and something that falls within the role of practice or the line of practice for that particular position. Okay, which situation will prompt the healthcare team to utilize the client's advanced directive when needing to make decisions for the client? 1, the client with head injury who is exhibiting guys, you know I can't pronounce. Decebrate posturing. 2, a client with a C6 spinal cord injury who's on a ventilator. 3, the client in chronic renal disease who's being placed on dialysis. Or 4, the client diagnosed with terminal cancer who's mentally retarded. And we don't use that word anymore, so we can just pretend I said mentally disabled. And guys, the correct answer is number 1. The client with a head injury who's exhibiting what? Decebrate posturing. That decebrate posturing, guys, that means that patient has severe brain damage that is not reversible. So that patient can't make decisions for themselves. They can't speak. They can't even blink. At least a patient on a ventilator, you ask them, do you want this? Blink once for yes and 2 for no. They'll go like this. Like they can blink, right? They can process thoughts. But that patient that has that decebrate posturing, no. They have severe, irreversible brain damage. Okay, let's look at our other choices. The client with renal disease on dialysis, they can still make decisions. They can still communicate. And the client diagnosed with terminal cancer who's mentally disabled. Just because they're mentally disabled does not mean that they cannot make decisions for themselves. Unless it is written that they have a legal guardian that can make decisions for themselves, they can still make their own decisions. So out of this list that we have, it's going to be obviously that patient that has that severe brain damage. They're not going to wake up. They're not going to be able to tell you what they want. The nurse is caring for clients on a skilled nursing unit. Which task should not be delegated to the unlicensed assistive personnel? 1, instruct the UAP to apply sequential compression devices to the client on strict bed rest. 2, ask the UAP to assist the radiology tech to perform a stat portable chest x-ray. 3, request the UAP to prepare the client for wound debridement at the bedside. Or 4, tell the UAP to take the INOs for all the clients on the unit. And guys, the correct answer, what the UAP cannot do, is number 3, request the UAP to prepare the client for wound debridement at the bedside. Why? Well, how do you prepare a client for wound debridement? You give them pain meds. Can UAPs give pain meds? No. That's why you can't delegate that to a UAP. But all the other ones you can. Let's look at these choices. 1, applying SCDs. UAPs are allowed to put SCDs just like they're allowed to put compression stockings. 2, assisting the radiology, what? Did it say the radiologist? No, because the radiologist is a physician. What did it say? Radiologist tech. Yeah, they can assist the radiologist tech with taking that x-ray, that's fine. And the last one, taking the INOs, yes, because the UAPs are allowed to what? Record and report. The clinic manager is discussing osteoporosis with the clinic staff. Which activity is an example of a secondary nursing intervention when discussing osteoporosis? 1, obtaining a bone density evaluation test on a female client older than 50. 2, performing spinal screening examination on all female clients. 3, encouraging the client to walk 30 minutes daily on a hard surface. Or 4, discussing risk factors for developing osteoporosis. And guys, the correct answer is 1, obtaining a bone density evaluation test on a female client older than 50. Now, I've talked to you guys about this before, and NCLEX is huge on these, so you have to know them. Your primary versus your secondary versus your tertiary forms of prevention, okay? Primary, teaching and vaccines. When you're teaching a patient how to prevent something from happening to them, giving vaccines to prevent them from getting a disease or disorder, that is a form of primary prevention. Secondary is when you're testing to see if the patient has it, and if they do have it, how bad it is. So a form of secondary prevention would be something like a bone density test, or a biopsy, or a mammogram, or a colonoscopy. That's secondary. And then you have tertiary. Tertiary is when the patient already has whatever it is, and we're trying to prevent it from getting worse. So tertiary form of prevention would be speech therapy, occupational therapy, things like that. So that's why number 1 is the correct answer. Let's look at our wrong choices. Number 2, perform spinal screening examination on all female clients. What did I tell you guys about these all-inclusives? All, always, never, only. Unless you know that you know that you know that you know that's the answer, stay away from them. Stay away from them. Look at this. It says to perform a spinal screening exam on all female clients. Number 1, spinal screenings we do for scoliosis, not osteoporosis. That's number 1. And number 2, when we do those spinal screenings for scoliosis, not osteoporosis, we don't do it for all females. We do it for who? Adolescent females, okay? 3, encourage the client to walk daily. That's a teaching, so that would have been a primary. And then 4, discussing risk factors. That's also a teaching. That would have been a primary. So our correct answer is number 1. The female home health aide calls the office and reports pain after feeling a pulling in her back when she was transferring the client from the bed to the wheelchair. Which priority action should the home health nurse tell the home health aide? 1, explain how to perform isometric exercises. 2, instruct her to go to the local ER. 3, tell her to complete an occurrence report. Or 4, recommend that she apply an ice pack to the back. So the very first thing you're going to instruct them to do is to put an ice pack to the back. This is something acute. This just happened. They just feel this pain. So remember, when it's something acute, it just happened, we're going to put ice. Ice is going to help decrease the inflammation. Ice is going to help decrease pain. Now, if this was a patient that had something long-term, this is something chronic, then we would tell them to use heat, right? But something acutely, we're going to tell them to put ice. How are we going to tell them to go to the ER? So they're going to go to the ER and leave our patient? Does that make any sense? Remember, guys, when you're answering these questions, your patient is always the priority. Their safety is always the priority. So you're going to tell the home health aide to apply ice, and that should decrease the pain, swelling, inflammation. Now, after they put ice and they're not feeling well and they got to go, then you can make some arrangements to get somebody else to come cover that patient before they go anywhere. But the very first thing you're going to teach them is to go ahead and put on ice, and usually that'll do the trick. The female client with osteoarthritis is 6 weeks post-op for open reduction and internal fixation of the right hip. The home health aide tells the home health nurse that the client will not get in the shower in the morning because she hurts all over. Which action would be most appropriate by the home health nurse? 1, tell the home health aide to allow the client to stay in bed until the pain goes away. 2, instruct the home health aide to get the client up to a chair and give her a bath. 3, explain to the home health aide the client should get up and take a warm shower. Or 4, arrange an appointment for the client to visit the healthcare provider. And guys, the correct answer is 3. Explain to the home health aide the client should get up and take a warm shower. Why? Movement and warmth is going to decrease the pain. So the more that patient is moving around, the less it's going to hurt. And that the warm water is going to relax those muscles and decrease the pain. So that's why number 3 is the correct answer. Let's look at the wrong answer choices. 1, tell the home health aide to allow the client to stay in bed. No, because we know the more that they're not moving, the more it's going to hurt. They need to move around so the pain can decrease. 2, instruct the home health aide to get the client up to... This client just had an ORIF to where? The hip. Are they supposed to be sitting up in the chair? Are they supposed to have that hip in a 90-degree angle? No. That's why they can't drive. They can't have that hip in that, they can't flex that hip in a 90-degree angle. Absolutely not. So you know that's false. Choice number 4, arrange an appointment. No. To go to a doctor. Why? We know what the problem is. They need to get moving. They need that warmth. So number 3 is the correct answer. Which home health nurse is discussing, the home health nurse is discussing the care of a client with the female home health aide. Which task should the home health nurse delegate to the home health aide? 1, instruct her to assist the client with a shower. 2, ask her to prepare the breakfast for the client. 3, request her to take the client to a doctor's appointment. Or 4, tell her to show the client how to use a glucometer. And the correct answer is 1, instruct her to help the client with a shower. This is a home health aide. Yeah, so they can help the client take a shower, bathe, brush their hair, get dressed, brush your teeth, ADLs. The new graduate nurse is assigned to work with an unlicensed assistive personnel to provide care to a group of clients. Which action by the nurse is the best method to evaluate whether delegated care is being provided? 1, check with the clients to see whether they're satisfied. 2, ask the charge nurse whether the UAP is qualified. 3, make rounds to see that the clients are being turned. Or 4, watch the UAP perform all the delegated tasks. And the correct answer is 3, do rounds. Guys, anything that you delegate, you are still responsible for that care. So before you delegate a task, you have to make sure that whoever you're delegating that task to understands what that task is and is proficient. They know they can do it. That's number 1. And number 2, after that task has been performed, it's your job to make sure that it was performed correctly. Okay, so you're gonna do rounds. Let's look at the wrong answer choices. 1, check with the clients to see whether they're satisfied. Them being satisfied and that who are we working with, that UAP doing their job are 2 different things. 2 different things. Because what if your task to a UAP was to get the patient is post-op, they just had surgery, and you gave them, it's day 2. So they walked already, it's the second day, they need to walk again. And you tell the UAP to go walk the patient. If you go and check to see if the patient's satisfied, most likely that patient's not going to be satisfied. Why? Because the UAP made them get up and they didn't want to. They wanted to stay in the bed. But the UAP did what they were supposed to do, right? So you're never going to check. And that's why I hate satisfaction, these, in the hospital, how they do these satisfaction surveys. Those are horrible because the best nurses usually get the worst survey, the worst scores, because the best nurses will have the patients do things that they may not want to do. You just had surgery. You don't want to get up and move. But me as a nurse, I know if you get up and move, that's going to decrease your chances of catching pneumonia or another infection. That's going to decrease your chances of getting a DVT. That's going to decrease your chances of getting a pulmonary embolism. So because I know what can happen to you and I educate you about it, I have you get up, and you're not happy with me for having you get up. You wanted to stay in bed. So you give me a big fat 0, but I did what I was supposed to do, right? So you're not going to ask the patient if they're satisfied. That seeing if the patient's satisfied doesn't let you know if what you delegated was done and done correctly. You have to do rounds. 2, asking the charge nurse, stop it. Remember, I told you, you don't pass the buck. You do not pass the buck. You check to see if whoever you're delegating to, you have to check to see if they can do whatever you want to delegate. So that's your job, not the charge nurse. And lastly, watch the UAP. What is the point of delegating a job if you're going to stand there and watch them do it the whole time? The whole point of delegating a task to someone else is that so you can go care for another patient or do something else. So number 3 is the correct answer. Okay, guys, and we are down to our last question. The charge nurse is making assignments on a pediatric unit. Which client should be assigned to the LPN? 1, the 6-year-old client diagnosed with sickle cell crisis. 2, the 8-year-old client diagnosed with biliary atresia. 3, the 10-year-old client diagnosed with anaphylaxis. Or 4, the 11-year-old client diagnosed with pneumonia. Whenever you guys get a question about which client you delegate to the LPN, what they're really asking you is which client is the most stable. And it's number 4, the 11-year-old with pneumonia. All we know is they're 11 years old and they have pneumonia, which is infection of the lungs. 1, 2, and 3 are not stable. Look at 1, sickle cell crisis. Hello, crisis. That patient's not stable. Number 2, client diagnosed with biliary atresia. Hello, that's also a medical emergency. Those bile ducts are what? Blocked. Number 3, client in anaphylaxis. That's a severe allergic reaction. None of those clients are stable. So you're not going to give that to an LPN, but the client with pneumonia, they have pneumonia. It doesn't say that they have pneumonia and they are in acute respiratory distress. All we know is they have pneumonia. That's the most stable client for us. That's who we're going to give to the LPN. All right, guys, I hope you found this video to be helpful. NCLEX is very, very big on delegation. They're very, very big on priority. So I'm going to make sure I get more of these types of questions for you. If there's anything you'd like to see me cover that I haven't done so already, or something I covered that you want to see more of, please go ahead, leave me a message in the comment section. I read them and I'll make sure that I put it on my list to make a video for you. Guys, don't forget, I'm on TikTok now. Check me on TikTok, Instagram, Facebook, and my tumblers. Don't forget my tumblers, guys. It's the summertime. People are graduating. The nursing student in your life that you love, that you want to support, go ahead and get them a tumbler. It's only $15, and you can find it on my website, nexusnursinginstitute.com. And don't forget to what? Like and subscribe. Okay, guys, you'll be seeing me on the next video.